before the break that we were going to be talking to a doctor here in the area on the ground. So got to speak a little bit earlier today with Dr. Jose Crespo with TeamHealth. He's the regional medical director for a few hospitals, both here in El Paso and Las Cruces. So talked with him a little bit earlier today about what the situation is here in El Paso on the ground and kind of within the region. Joining me now, we have Dr. Jose Crespo, TeamHealth Regional Medical Director here in El Paso. Thank you very much for joining us today.
Thank you for having me.
I am sure you are incredibly busy, and you are actively both managing some of the care that is happening in El Paso and Las Cruces hospitals and doing shifts in our hospitals as well. Is that accurate?
That's correct.
From that perspective, let's start first off with kind of regional. What is the situation we're seeing within El Paso and Las Cruces hospitals when it comes to this COVID-19 response?
Well, our response has been fantastic. We've received, lots of support from the state, as well as lots of support from TeamHealth as an organization. We've had many doctors from TeamHealth and the state, come to these areas to backfill any needs that are needed on the inpatient side and on the higher acuity side. So it's been fantastic response and collaboration with everyone.
Yeah, a lot of resources have been brought to town and a lot of personnel. So there had been some concerns about shortages. And I mean, certainly the amount of space, but we've had additional spaces set up. When it comes to just strict resources, what would you say the situation here is in the region?
My opinion is that the resources are great. We have everything we need. We have physicians from TeamHealth who have come from Austin and other areas of Texas and other states. Everyone's been wonderful, all hands on deck. We've seen a lot of support from my company. Also, we see a lot of support from the DMAT team and the Department of Defense, as well as the Health Human Services. Everyone's really been fantastic. I can't express the gratitude that we have and that our patients are doing well because of this.
So are there any concerns that you have about if things continue on this trajectory of running out of resources or space, particularly as we're starting to see caseloads increase in other parts of the country where these resources and personnel were being sent from?
How can I say, in terms of resources, I feel real comfortable that El Paso we have enough resources here. Yes, there's always an issue of concern with the real estate and location of caring for patients. COVID patients are typically staying inpatient longer, so it can make it challenging. However, at this point, we've been doing really well.
That's very good to know. So give people a little bit of more of an idea of the scope here, because you are the regional medical director for, I think you said 4 hospitals that we were talking about before within the region?
Yes, sir.
Which hospitals are those?
So Del Sol, Las Palmas, Del Sol, Maine, Las Palmas, Del Sol, Maine. We have 4 freestandings, Horizon, East, Northeast, and West. We're taking care of patients in all these hospitals.
And then on the flip side as well, you are also actually doing shifts within, particularly in emergency medical shifts at some of these hospitals as well, right?
Yes, sir. Yes, I actually see patients.
What are you seeing during those times here? We've heard a lot about how many calls have been going on for El Paso Fire Department having to go to COVID calls and those kind of turnarounds. Of you being on then the receiving side of that, what is that overall situation?
That's a good question. Well, the situation is simple. While the city is kind of, quiet in the sense that, people are not really out and about and doing things, and the EDs may appear to be busy, what we're really seeing is a higher acuity on patients. So, the patients that do come, come pretty sick. A lot of them wait too long to get care, which makes the acuity a little bit challenging. Overall, I encourage the patients that, if you're feeling sick, if you're feeling ill, do see your doctor or come see us. I know there's a lot of phobia out there, patients that are having chest pains or non-COVID related illnesses or complications are afraid to come to the emergency departments. And as a result of that, their illness gets sicker, so they come in with a higher acuity. So again, all our hospitals are safe. We're here for the community. We're well prepared to take care of their healthcare needs. But, when they do feel bad, they should really seek medical attention sooner rather than later. Now, that being said, I also want to say that, just because a patient turns positive doesn't mean that they're really sick. So there is, some concern that some of the patients do show up, resulted with a positive test, but they're not having any symptoms, or if they are, they're not having symptoms that over-the-counter medicine can't take care of. And again, I stress the importance, if you're feeling really sick, if you're feeling short of breath, if you're unable to keep medicines down, then that's the time to come see us. Don't wait at home to get sicker. But, if you're about and you just have, simple sniffles, low-grade fever, but you're not feeling so bad that you need air, stay home.
Yeah, definitely. My guest right now is Dr. Jose Crespo, the TeamHealth Regional Medical Director. We're talking about the situations here on the ground and in El Paso's hospitals. And yeah, very important point there. If you need medical attention, seek it, because waiting probably won't make it better on its own if the care that you're trying to give yourself isn't working. But also, I understand a lot of people not wanting to go into particularly emergency departments right now, but if it's necessary, please take that step. Another major thing that we've heard, of course, in the region has been some videos going around from people who have been brought into the area, traveling nurses as they've been called, about situations that have been happening here, particularly as it refers to as pits in some area. What is your perspective on what the situation is in these critical care and these specific COVID wards?
Well, the wards are made specifically to take care of those specific type of patients. I kind of, I chuckle when I hear the word pit. At times, healthcare providers, to ease the stress, will make, kind of comments like that, but we really don't have any pits per se. We have areas that are, again, well taken care of, well ventilated, properly sanitized, where we like to take care of specific type of patients in that area for both patient safety and staff safety. But we do not have what they so-call the pit. That's not true.
The fact of the matter is that, as has been shown for a while now, that if people have to go onto a ventilator, that usually means that their situation has gotten to a point where recovery becomes less likely. But some people seemed like people were being abandoned in here, and that is not the case, right?
Not at all. Not at all. Look, healthcare providers take oaths. We're here for the benefit of our patients and humanity. And, I would be appalled to hear someone say something like that. I look at my colleagues, I look at the colleagues that come from abroad to help out. People are here, because they want to be here to help, our needs in our El Pasoans. And I've seen nothing but excellent collegial collaboration. We've met some good friends here now, because we've shared this experience and, shared the field of combat, taking care of these patients. And again, I've not seen anyone give up or show up to work with any type of poor attitude. My appreciation goes to all my colleagues and all the FEMA and DMAT nurses and providers that come out here, because they answer the call of the sick, and that should be commended.
In the situations that you've dealt with, we've heard a lot about, from different areas around the country, about people coming in seemingly not taking this seriously. You mentioned there a couple different ways of people being both maybe waiting too long or maybe being a bit too concerned about what is not ultimately that serious. But do people at the very least seem to be taking the factors of the disease, of COVID-19 and the coronavirus, seriously, or are you finding a lot of resistance to the idea that it is happening here?
No, I feel that they're taking it serious to a point. It really varies. We live in a culture that, we're a very touchy-feely community in the sense that we like to be, around, very family-oriented. So it's really difficult to maintain social distance. COVID is an illness that you can't physically see, like a fracture or a laceration. I think the community sometimes, does face a challenge. Some people feel that they might be immune to it, and, COVID doesn't discriminate. We just don't know who's going to have a worse outcome than another.
Is there anything you would like the public in general to know from your experience and what you've seen here and your perspective about the situation right now and what they need to know going forward?
Yeah, I think education is probably the best weapon the community can use now. So the more you know about safety precautions that you can take, not just for yourself but for your family and for other in the community will go a long way. You know, I stress the importance of proper hygiene, hand washing, you know, social distance, utilizing the mask, and taking, you know, every precaution you can to prevent the spreading of this. And with that attitude, we'll get by. We'll get over this.
Is there anything in particular that you all need, or you need to have marshaled for you all to be able to continue this response, or anything just make it so that we can all make it through this?
At this point, I have all I need. You know, the hospitals have been phenomenal with resources. You know, I cannot stress enough. You know, Del Sol Las Palmas has been, you know, wonderful with PPE. They've been extremely receptive to suggestions. They basically have provided everything we need to get through this.
One last question here for you. There has been a hot button discussion about this locally and nationwide, that there's a quote incentive to label people who have or may have a coronavirus, and particularly if they die, as COVID deaths. Is that even a consideration when it comes to how you deal with things, given that we've been at capacity?
Not at all, sir. Not at all.
All right. Well, thank you very much. Guest right now has been Dr. Jose Crespo, TeamHealth Regional Medical Director. Thank you very much for taking the time out of your incredibly busy day to speak with us about the situation in our hospitals here in the region.
Thank you for having me.
So again, that was Dr. Jose Crespo. We thank him for taking the time. You could hear the hospital noises there in the background, and them taking the time to speak with us about what the situation is and give us a little bit of clarity on some of these issues we talk a lot about here on this show.